All right, let's jump right into a topic that is absolutely critical for your nursing exams and, your future clinical practice. Hyperosmolar Hyperglycemic State, or HHS. Think of this as your complete study guide. We're going to break it all down piece by piece so you can walk away feeling like you've completely mastered this topic.
So here's our game plan. We'll start with the absolute core concept of HHS. Then we'll dig into how it develops and what it looks like in a real patient. After that, we'll cover the labs, the priority medical treatments, and of course, your key nursing priorities. And we'll wrap it all up with a high-yield NCLEX review to make sure it all sticks. Let's do it.
Okay, so first things first, what in the world is hyperosmolar hyperglycemic state? Let's get a really solid definition down because, trust me, if you understand the core components, everything else just clicks into place.
Think of this slide as the 4 pillars of HHS. First, you've got blood sugar that is just sky high. That extreme sugar level leads to our second pillar, profound, severe dehydration. This dehydration then makes the blood super thick and concentrated. That's what we call high serum osmolarity. And the fourth, and this is a crucial piece of the puzzle, is that there are little to no ketones. It's all about that extreme dehydration driven by a crazy amount of sugar in the blood.
Okay. If you remember one single thing from this entire explainer, please make it this right here. This is the golden rule of HHS. What's happening is the patient's body is making just a tiny, tiny bit of insulin. It's just enough to stop the body from breaking down fat for energy, which prevents ketones, but it is nowhere near enough to handle that massive glucose load. This is the key reason you don't see the acidosis that's famous in DKA, and it's a classic NCLEX test question. And you need to lock this demographic into your brain. When you see a test question about an older adult with type 2 diabetes who is suddenly very sick, your HHS alarm bells should be going off like crazy. This is your classic patient.
So now that we know what HHS is, let's trace the dangerous domino effect of how it happens and what you're actually going to see when you walk into that patient's room.
Okay, just follow the chain reaction here. It all starts with not quite enough insulin. So glucose just builds and builds in the blood to insane levels. The kidneys, trying to be helpful, start dumping all that extra sugar into the urine. But here's the problem. A ton of water follows it. This is what we call massive osmotic diuresis. This makes the blood incredibly concentrated and thick, which then starts pulling even more water out of the body's cells. And the brain cells, well, they are super sensitive to this, which leads to that final most dangerous step, neurologic symptoms. The biggest, baddest problem in HHS is severe, life-threatening dehydration, period. So, what kicks this whole thing off? Well, just look at that star. Infection is, by a long shot, the #1 trigger. An older patient with a UTI or pneumonia, that's a classic setup for HHS. But really, any major stress on the body, an illness, a surgery, even some medications, can push a vulnerable person right over the edge. You will definitely be tested on this. This slide is basically the formula you need to burn into your memory. An older patient, plus an infection, plus dehydration. If you see those 3 things together in a test question, you should be thinking HHS, HHS, HHS. It's a huge clue. So what does this patient actually look like? Well, as you can see, it might start off kind of subtle. They're peeing a lot, they're tired, but as that dehydration gets worse and worse, their vitals start to change. You'll see that low blood pressure and fast heart rate. And that dehydration is especially tough on the brain, which leads to the absolute hallmark sign of HHS, altered mental status. We're talking anything from just a little confusion all the way to profound lethargy, seizures, or even a coma.
And here is a massive NCLEX red flag for you. You know Kussmaul respirations, right? That deep, fast breathing? That's the body's way of trying to blow off acid. Well, since HHS patients are not acidotic, you won't see it. So if you've got a patient with altered mental status, but their breathing looks normal, your brain should be screaming HHS.
Okay, so we've got a pretty good idea of what's going on based on the clinical picture. But now we need the hard data, the lab values, that are going to give us that definitive diagnosis. And yeah, you're going to have to memorize these numbers.
This table really tells the whole story. The blood glucose is just astronomical, way up over 600. The serum osmolality is over 320, which confirms that the blood is super concentrated. And then look at the bottom half. Ketones are nowhere to be found and the pH is totally normal. Greater than 7.30, no acidosis here. I really want to pause on this number. This value, that serum osmolality greater than 320, this is what's directly causing those scary neurologic symptoms. It's a direct reflection of that extreme dehydration happening at the cellular level. This is what makes HHS so incredibly dangerous.
Please, whatever you do, do not fall into this trap. A lot of students think that because there's no acidosis, HHS is somehow, less bad than DKA. The exact opposite is true. That profound dehydration and the crazy electrolyte imbalances in HHS lead to a much, much higher mortality rate. This is an incredibly serious condition.
All right, this section right here is arguably the most important one for your exams and for real life. We've got the diagnosis. What is the very first thing you do? Priority is absolutely everything here. Look at that flame emoji and the star. The absolute #1 do not pass go priority is IV fluids. We have to fix that severe dehydration, and we're talking about huge volumes of normal saline. It's only after we've started rehydrating the patient that we can even think about starting an IV insulin drip. If you give insulin first, without fluids, it can cause a rapid fluid shift into the cells and lead to cardiovascular collapse. So remember, fluids first, then insulin.
Okay, so the doctor has ordered the fluids and the insulin. Now let's really focus on your crucial role as the nurse. What are you going to be looking at, assessing, and doing, minute by minute?
An HHS patient requires intensive one-on-one monitoring. You are going to be checking their glucose every single hour. You're tracking every single drop of fluid going in and coming out. But what's the best way to know if your treatment is working? It's their neurostatus. As you rehydrate their brain, you should see that confusion and lethargy start to get better. That's your most important assessment, bar none.
Okay, we have covered a ton of ground. Now let's switch gears into a rapid-fire review to really hammer home the absolute must-know facts for your NCLEX exam. Ready? This comparison chart is pure exam gold. Just look at the key differences. HHS is for type 2, DKA for type 1. HHS has that much higher glucose and way more severe dehydration. But the biggest difference, the one they love to test, is the ketones and acidosis, gone in HHS, present in DKA. And never forget, HHS actually has the higher mortality rate. Need a quick and easy way to remember this when you're stressed out during a test? I got you. For HHS, just think high sugar, sane pH. The pH is normal, it's sane. For DKA, think ketones kill the pH. The ketones cause the acidosis and kill that pH. Simple, effective, and it'll save you on an exam. And let's lock it in with just a few more one-liners. HHS dries the brain. That reminds you the core problem driving the symptoms is neurologic dehydration. No ketones, still deadly, a quick reminder of that high mortality rate. And the most important action, fluids before insulin. Say it with me, fluids before insulin.
Okay, time for a little pop quiz. Let's put it all together. You've got an elderly patient, type 2 diabetes, glucose of 890, they're confused, their skin is dry, and there are no ketones. What is your priority intervention? Take a second. Think about it.
The correct answer is, of course, C. Begin IV normal saline. Why? Because what have we been saying this whole time? The most immediate, life-threatening problem in HHS is that profound fluid loss. We have to restore their fluid volume before we do anything else.
And we'll end on this, a next-gen style clinical judgment challenge. Your patient's numbers are actually looking better. Their glucose is coming down, but their mental status is getting worse. What are you thinking about? What complications could be happening? What assessments and actions would you take next? This is where real nursing and critical thinking comes in. Mull that one over. You've got this. Keep studying.